myopia management, there are many treatment regimes available for patients because we have a variety of spectacle lens options, contact lens options, and low-dose atropine. It enables us to really think about what is the best treatment for the patient, both in terms of efficacy and the evidence for that treatment, as well as what is going to suit the patient best in terms of their lifestyle and their capacities for vision correction and myopia control. Axial length is the length of the eyeball, and we know in children that the eyeball is meant to grow from birth until around age 10 to 12 and then stop. But in myopia, that eye growth is accelerated, or it keeps growing, and these eyes can keep growing throughout childhood and even into the early 20s in some myopes. So in myopia management, the key thing we're wanting to do is to slow down that excessive growth of the eye, because we know that that length and that stretching of the retina is the key risk factor for the eye diseases that are more associated with myopia. Low-dose atropine is a very low concentration of atropine, which we've traditionally used in eye care for a long time for diagnostics and for treatment of inflammation, for example, but very low concentrations of atropine, something like 1/100th to 1/20th of what we would use in clinic traditionally, have been shown to slow progression of myopia in children. Soft contact lenses for myopia management can be thought of as doing two different things at the same time. Firstly, they correct vision so that a child who's wearing them can see clearly. So there are zones of focus within the contact lens for giving a child clear vision. There are also zones of focus within the contact lens that create a different signal, a signal that falls in front of the retina at the back of the eye instead of falling on the retina, which is what we normally do to correct vision. And this part of the signal that falls in front of the retina creates a slowdown signal for eye growth. So it's asking that eye of a child with myopia to stop growing so quickly, or to slow down with that excessive growth. And that means the child can both see clearly, as well as they're wearing something which can slow down the progression of their myopia. Soft contact lenses for myopia management are similar to spectacle lens designs for myopia management, because these new generation of spectacle lenses that we now have available follow a similar concept, where they have part of the spectacle lens to correct vision and part of the spectacle lens creating signals to slow down eye growth. Orthokeratology is a special type of breathable contact lens that you wear overnight, and it gently reshapes the surface of the eye, so when you take them off in the morning, you don't have to wear spectacles or contact lenses during the day. What we've learnt about Ortho-K is that it creates this special profile on the surface of the eye which slows down progression or worsening of myopia in children. And it does that because it corrects vision, as well as creates these areas on the surface of the eye that create a different visual signal at the back of the eye to slow down eye growth. MiSight lenses can help children with myopia in two very important ways. Firstly, they get the benefit of wearing contact lenses, and there's been lots of research to show that there are enormous benefits for kids and teens wearing contact lenses in terms of their self-confidence, their ability to participate in activities, and their satisfaction with their vision correction. The research shows us that MiSight one-day contact lenses are extremely effective for slowing down myopia progression in children. They appear to be slowing progression by at least half compared to kids wearing normal standard contact lenses. MiSight contact lenses have also been shown to have a very high safety profile, so 6 years of full-time wear of MiSight one-day contact lenses have shown no measurable impact on the surface of the eye in children. And these children have been wearing contact lenses from age 8 to 12 right through for 6 years. What we know with myopia progression is that kids' eyes, their vision gets worse and worse every few to several months, and if you're not wearing a myopia management treatment, and you're a child, your vision's changing, it's constantly changing. It's changing between eye exams. If you're wearing something like MiSight, you have clear vision, you have stable vision, and it's not changing as often. So it's just a much better overall visual experience for children. The best way to wear these contact lenses is full time. The research shows us that if we're wearing them for 12, 13 hours a day, 6.5 to 7 days a week, they're safe, they work really well, and that's how we're going to get the best results from them. Patients tend to find contact lenses very comfortable, and it's normal for patients to take a few days to a week to adapt to their contact lenses, and I describe it like wearing a new pair of shoes. Once you've worn them a few times, they're just there, your brain stops paying attention to them, and they're very comfortable. Obviously, when you're wearing contact lenses, you can see just like you have nothing wrong with your vision at all. With spectacles, you notice if you put a fingerprint on them, you might have to change to sunglasses when you go outdoors. There's just a little bit more, I guess, bother through the day with wearing spectacles. But they both have their benefits, and it's good for people to have both. So even if you're wearing contact lenses all the time, it's important that you do have some glasses to wear at times as well. MiSight one-day contact lenses are daily disposable. That means you wear them for the day and then you get a fresh pair the next day. Lots of research has shown us that daily disposables are the safest way to wear contact lenses. So there's the lowest risk of complications, of sore eyes, of eye infections with daily disposable contact lenses compared to soft lenses that are worn reused, so worn maybe for 2 weeks or worn for a month. When I'm talking to parents about the benefits of MiSight contact lenses or about contact lens wear in general for children, I think it's really important for them to understand that this is not an unusual thing. It's not a weird thing for kids to wear contact lenses, and for them to understand that I have hundreds, thousands of kids that I have fit with contact lenses who are successful and safe and very much able to manage and handle them. Parents are worried that kids won't be able to put the contacts on or take them off. Parents can be worried that it's not safe. Well, we can address that with the research and say that the safety profile is very high. Parents might be worried that children may not see as well with their contact lenses, when in fact their vision is just as good as with glasses, and for very high prescriptions, sometimes it can even be better with contact lenses. So I think it's really important to address what the parent is concerned about and to explain that contact lenses can be extremely safe, extremely beneficial, and quite manageable for kids to wear.